Panic
Yeah.
attacks, you know, don't make you feel good, but it's not killing you. And I wanted to ask you, I know a lot of people are confused about this. What is the difference between a heart attack and a panic attack? Because some people have a panic attack and they think, I'm having a heart attack. What is the
Yeah.
difference?
It's tough to tell the difference many times because the symptoms can be so similar, and panic attacks can be very physical as well.
Of course.
And, so what are those symptoms? Well, some of the things we've already talked about: shortness of breath, sweating,
Mm-hmm.
chest discomfort, nausea, changes in vision, all these things. They can be panic attack, they can be heart attack. How do you tell the difference? Well, panic attacks typically are brought on by emotional scenarios, not always, but typically speaking. They'll typically last 10 to 30 minutes, self-limited, and then they'll ease off. Heart attacks, on the other hand, are you typically have some warning signs of the progression of the discomfort before it comes on and doesn't go away. It's crushing chest pain, not a sharp chest pain, and it doesn't get better with time. And that's a key, and that is a true medical emergency. Now, if you're in one of those scenarios and you're not sure, then you need to go to the hospital, because that's always the safest thing to do. Because with an EKG and a simple blood test, that can be delineated pretty easily.
Okay.
So it's a difficult scenario. It really is. And people frequently during panic attacks will say, I'm having a heart attack. Now, the other important thing is panic attacks do not cause heart attacks. And I think that's a spin that a lot of folks will get into. Yes, I'm having a panic attack, but now I'm having a heart attack. That would be very, very unusual.
Very rare.
Very, very rare for that.
Panic attacks, don't make you feel good, but it's not killing you.
Correct.
Right.
Exactly.
It might be influencing your overall health, but it's not creating a heart attack.
Right. Right. And you may fear for your life
during
a panic attack. I've seen that many, many times, but you're not in danger.
What's the best thing someone can do to recover from a panic attack?
Yeah. So
it doesn't happen again,
Yeah. Well, so it doesn't happen again requires coping skills. But to break a panic attack, what you really want to do is divert your nervous system in some way. The fastest way that I have found to do that is take a bag of ice, fill it up, and put it on the back of the neck, and it just kind of changes your whole focus. If you don't have a bag of ice, you can, just put your face under cold water, whatever opportunity you have. If you're driving, please pull over, get a cup of ice from the convenience store and put your hands in it, or just hold on to some ice is usually enough, and it'll frequently break a panic attack. Now, treatment of panic attacks is way outside of my wheelhouse as far as long-term coping skills and things of that nature. But I think the good news is, in most cases, with appropriate support and guidance, people can get over panic attacks.
Okay.
I mean, I really think, and anxiety in general, I think that it's not something that people have to live with forever.
Okay, so I'm going to ask you 1 through 10, 10 being the best, 1 being the least best. 1 through 10, how valuable is saunas for helping heart health?
So I am a huge believer in sauna therapy. Now, all of the data has been done in traditional Finnish saunas. I don't have a problem with the other alternatives,
Infrared or whatever you have.
with the infrared type saunas, and there's some other ones out there. But if we're going to talk about the data and what I personally use, that's where I think the money lies, if you will. So the numbers are dramatic. That if you are utilizing sauna 4 to 5 times a week, sessions of 11 to 12 minutes each, that 11-minute mark seems to be important, somewhere over 175 to 180 degrees Fahrenheit, your decrease in cardiovascular events is greater than 50%.
Wow.
And all-cause mortality is in that same level as well. In addition, now the neurocognitive benefits of sauna are starting to come out as far as being protective from Alzheimer's, dementia, what have you. Why does all of this happen? And I don't really have the capability to dive deeply into the science, but the basics is that we release something called a heat shock protein when you're in the sauna, particularly when you get to that uncomfortable place in the sauna, seems to be where you really have this release.
You stay just a couple of minutes.
A little
more.
bit,
Yeah.
a little bit longer is where you really get the benefit. And that is where the cardiovascular, all-cause mortality, and neuroprotective benefits come from.
So 1 through 10, what do you think? Is that a 10 for you? Is that an 8, 9?
It's a 10 for me. I sauna at least 3 to 4 times.
Wow.
Every single week.
Okay, 1 through 10, ice therapy, cold therapy.
So personally speaking, I am a huge believer in cold plunges.
Yeah.
It's my morning routine, every single morning, 4 a.m. You know, I like to start the day with something hard. It puts my whole mindset in perspective. It wakes me up because you get this cortisol release, and it really sets the tone. Plus, as I'm peaking at 60 here and like to stay really active, you know, when I get out of bed in the morning, my wife will say to me, "What hurts?" And I'll say, "Look, it'll be quicker for me to tell you the things that don't hurt right now." She's like, "Well, that's not good." But cold plunging really helps on a day-to-day basis to keep all of that under control. The data from a cardiovascular standpoint and really overall longevity standpoint is not as powerful as it is with sauna.
Gotcha.
I can't tell you specifically what it is off the top of my head, but from a cardiovascular standpoint, I would say that I would have to put that on the lower end of the spectrum, 1 to 10. But for personal impact and the way that I've utilized it, it's an 11.
What about over 7 hours of sleep?
Yeah.
On 1 to 10 scale for heart health.
It's a 10 plus.
Really?
It really is. Because again, if we look at the recovery piece, what does that really impact? Well, the risk of type 2 diabetes and metabolic syndrome and how your body metabolizes glucose all changes when you're recovered and well rested. Sleep apnea, where your oxygen level is changing during the evening, again, affecting the hours of sleep that you have, is a direct risk factor for high blood pressure, which we know is a risk factor, consequently to heart disease.
Yeah, I guess the only thing I could, you know, I've never been drunk, so I don't know what that feels like, but I have been on a lack of sleep at different times in my life.
Yeah.
And I can almost sense that it feels like you're drunk. So if you're not sleeping well, you're not performing well the next day, and it's starting to stack if you don't sleep well every night.
Yeah.
And so I can only imagine how much it could be hurting your physical health and creating excess fat and therefore impacting your heart.
Absolutely. Yeah. I think it's one of the pillars that people miss many times. You know, it's not a new gym membership. It's not whatever, PR lifting or cold plunging or whatever. It's like, you know, you need to prioritize your sleep. We all have to sleep.
That's great. Thank you for watching this video. If you want more inspiring clips like this, make sure to click right here to subscribe and click right here to watch that next video that is specific to support you in your life.